So here's an unusual case regarding a 45-year-old woman who had some swelling in her front maxilla associated with tooth number 7 that had a really large periapical radiolucency, and we were able to save this tooth for her. And she just had all her front teeth crowns done by a friend of mine about 10 years ago, and at the time she had a root canal done on number 7 right here. Tooth number 7 has a very large periapical radiolucency, and she had some pain associated with that. On the initial visit, told her because of the size of the infection and the radiolucency, I don't feel comfortable retreating it because the success rate comes down a bit. So I told her the best option is to do an epicoectomy and go in surgically and remove the granulation tissue. She agreed to that. She came back. You can see that the radiolucency is way over an average size radiolucency or periapical infection. And looking at the borders of this radiolucency, you can kind of see very well defined borders. The epicoectomy done, we did the MTA, retrofill, and bone grafting. And once we removed the granulation tissue, it was a very hard tissue with epithelial cells around it. It was kind of like a skin type tissue, and that tells me that it was a cyst in there. Usually a cause of that is bacteria coming from the root canal space and causing, or bacteria basically is gram-positive anaerobic bacteria that causes the granulation tissue, and then it turns into sometimes a periapical cyst with well-defined borders. And as you can see on the video, it comes out in one piece, and it was a very large area. We got it out, and I saw her for a 1-week post-op x-ray or follow-up, and she is doing wonderful, no problems. She's doing great.